Good morning, everybody. Thank you very much for registering your interest with us today on the Tackling Childhood Obesity in Greater Manchester webinar. I hope you had a relatively good journey on the way to finding yourself onto the webinar itself. And I hope you've not had too many technical problems. But welcome. My name is Jack Carney. I'm a volunteer at Salford Metropolitan Athletic Club, and I'm also a local resident in Salford. I also happen to be the co-chair of the Obesity Awareness and Support Information Service, called OASIS for short. My other colleague who's the co-chair is Professor Siba Senapati, and he is the consultant bariatric surgeon from Salford Royal Hospital. And you'll be hearing from Siba a little later. When Siba and I and some of Siba's colleagues from Salford Royal, when we co-founded the group about 5 years ago, what we wanted to do was to bring together people from the world of medical intervention and prevention in order to join up our strategies and our approaches to tackling the issues of obesity. That means that what we've had around the table over the last 5 years is quite an interesting mix of people. GPs, consultant surgeons, clinicians, dietitians, health improvement people, people from local schools and universities, people from local leisure services and voluntary and community workers as well. So it's been quite an interesting mix of people, and we've very much enjoyed working together, and this is the culmination of our efforts. We did originally plan this conference for earlier in the year in March, but of course that coincided with the first week of lockdown. So unfortunately we had to postpone it until now. So although we're not able to see one another or speak to one another, we think this is the second best thing. So we do hope that you bear with us on this. Just a quick reminder, before I go into the program and explain how the program is going to work today, I just wanted to say a few acknowledgements and thank yous. First of all, to Quilter, Quilter Finance. They are sponsoring this event in terms of allowing us to use their platform so that we can reach so many people. They're used to running big online conferences, and they've allowed us to use their platform to do this. So thank you to them. Thank you also to people in the background, Stevie from ABL Health and Alison from BIDA, the British International Doctors Association. They've been working tirelessly in the background to help us bring this event to fruition, and they're on hand today with any technical backup support. So thank you guys, really appreciate it. Okay, without further ado, let's have a look at the program. The program is divided into two sessions. Session one is going to focus very much on the context and the challenges around childhood obesity in Greater Manchester. And we're going to be hearing that from a number of different perspectives. We're going to hear it from politicians. We're going to hear it from medical people. We're going to hear it from public health, from the media, and from education. So there's quite an interesting mix of different sectors that are going to contribute to what they feel are the context and challenges around childhood obesity. In the second session, we're then going to move on at looking at some very practical examples, some initiatives on the ground through local schools, through local health improvement services, through local voluntary and community projects, what's actually happening on the ground in terms of tackling this massive challenge of obesity. You've probably seen on screen that as we go through the morning, we want you to consider those two key questions. From what you hear during the morning, and certainly through your own experiences, you'll have a wealth of experience that you want to bring to this too. We'd like you to think, are there particular things you feel we need to be giving more consideration to when we come to make policy and resource decisions? And secondly, do you feel that there's anything that we're not getting right, or any opportunities that you feel we're missing? So if you could think of those two things as we go through the session. And what you'll be able to do is to interact with one another. If you look at the bottom of the screen, you have a chat box. So if you want to make any comments or make any observations or talk to one another, you can interact in that way through the chat box. If you want to ask any questions of the panelists, and the panels will be taking place at the end of session one and session two, and they will comprise the people who've done the presentations plus a few other invited guests. So if there are any particular questions you want to ask, please make sure that your questions go in the Q&A box, and we'll do our best to make sure that your questions are answered. What we want to do is we want to get to the end of the morning and not have a so what moment. We don't want to get to the end of this and say, well, so what? We've heard all of this stuff. What do we do now? What we intend to do, we're recording this. We're recording the whole event. We're going to gather all of your comments, all of your questions, any conclusions we come to, and we're going to feed all of that back into a consolidated report back to the Greater Manchester Mayor, the City Mayors, the Chief Executive of the Northern Care Alliance, and the Greater Manchester Healthcare Partnership. So key people and key bodies that make important strategic decisions about policy and resources. So we want to feed all of that back to those people.